Medical Matters.
Our guest is Dr. Matome Kganakga. He is a general practitioner. We're talking about your ears. Dr. Kganakga, thank you so much for joining us. I really appreciate your time.
Good evening, my good sir.
So the ear, I mean, I have a love-hate relationship with my ears because I get these itches, right? Oh, and I think they call them eargasms, right? Oh, it feels so good when you give them a nice little scratch. But I also know that I'm not supposed to do that. Why is the ear so lekker, man? Hey, Dr. Kganakga, why is it so nice when you scratch the ear, man? Until your eyes go squint, it's so nice.
Yeah. Oh, yeah. Yeah, no. The ear, it's one of the most important organs in our body. It's one of the sensory organs. So that basically means there's a whole lot of nerves that are involved there. So, that beautiful, nice itch, it activates a whole lot of nerves, hence the excitement.
Okay. And is it correct for us to be scratching our ears? I remember at school somebody saying that the smallest thing that should try and go into your ear is your elbow.
Yeah, I strongly agree with that statement.
Yep.
Ideally, an ear is a special canal, the canal that is closed at the end. So we've got an eardrum, we've got an opening on the outside. The main idea behind the creator is the sound waves will, go into that canal, activate the eardrum, and the eardrum will generate wave sounds that will go into the brain so that we can hear. Now, that canal is so special that God did not want anything else in the ear. Hence, we've got even wax to trap unwanted stuffs, your pollen, your dust. Contrary to a popular belief, we are told wax is dead. Wax is part and parcel of our ears. We're supposed to have wax. And so by putting stuff in the ear, unfortunately, we interfere with natural mechanism. So the wax is released on the innermost of the ear, and it comes on the outside. The moment you pick up, hence, you'll notice I call it a cotton bud, not an earbud. Hence, when you put that cotton bud in your ear, you are reversing the wax that was supposed to come out. You're pushing it backwards. As you can think of a wax that was liquid, and when you push it backwards, it becomes more and more solid.
Yes.
One of the main reasons why people would now end up having to come that we wash or wax or cleanse their ears.
What is the significance of the itch? I mean, I'm comfortable with your explanation around the fact that the ear has got different compartments to it, and some are naturally not supposed to be accessed by somebody from outside and all of those things. I get that. But what does it mean when we have so much itchiness in the ear? And particularly children. Children seem to be very susceptible to ear aches or ear infections. What does it mean when we have so much itchiness in the ear?
Yeah, small children, I would say, to make it simpler, their bodies have not been exposed to a whole lot of things, and they therefore tend to react to a variety of things. So being exposed to a product, for example, for the first time, be it a pollen, be it grass, be it smoke, any of those, unfortunately, they overreact compared to adults. Because of not being exposed to those particular things. So the children are much more vulnerable to infections purely because of those. And naturally, children also, they like to explore because this ear, it's had an organ with such a nice feeling. They'll tend to even go as far as putting stuff in their ears, testing to see what would happen if I put stuff in that opening space in my head.
Give us a call, 011-883-0702, 021-446-0567 as I speak to Dr. Matome Kganakga. He's a general practitioner. We're talking about your ear and any questions that you may have with regards to here, any complications, any questions around conditions that you may have experienced in the past with regards to your ears. You said that the wax that comes from the ear, does it come from behind the eardrum or before the eardrum?
Before the eardrum.
Okay, so it's still part of the external part of the ear before we reach those little bones. I remember at biology at school we had those 3 little bones that they used to talk a lot about, the stirrup and the rah, 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 rah. Anyway, but what does that, where does that get produced, and what is the reason for the wax?
The reason for the wax is the canal. Ideally, it's not an accessible area. The wax is one, waterproof. It helps if you're swimming, for example, if you're taking a shower, if you're bathing. Ideally, after those activities, the ears are supposed to be dried up. So wax is not friendly for water, and therefore water would not stay there for too long. Because if the ears are wet for too long, it's a recipe for disaster. Bacteria will breed there, will make a party. If you think about it, in your sleep, should an ant or a cockroach crawl into your ear, unfortunately, that's a problem. So when there's wax, those organisms will not find it friendly to stay in a person's ear. So wax is very important. We should have, to a certain degree, a certain amount of wax in our ear.
Are there specific or special glands in that part of the ear that produce the wax?
Yes, definitely.
Okay. The types of infections, and I've heard of something like the otitis media. What is that?
Mm-hmm. The ear has got 3 compartments. We've got the external part, we've got the middle part, and the inner part. So the name media comes from the middle. So otitis media is an infection that occurs in a naturally air-filled space of our ear, mostly because of there's a tube called an eustachian tube that connects our throat to the middle ear. If you've taken a flight or you've moved from a high level, when you feel that pop in your ear, that's when there's an imbalance of the pressure in that space, the airflow space.
At 6. If you put in a bid for Royal AM, if you win, what do you actually buy?
My apologies, Dr. Kganakga. Not sure what happened. There it goes again.
Or Stephen Groot.
Stephen is encroaching on my show. Huh?
Yeah.
Anyway, so you were saying, Dr. Kganakga?
Yes, the eustachian tube. It's a tube that is designed to create a balance so that eardrum does not pop as uncomfortable as it does in a flight. So unfortunately, that very tube in smaller children, when they've got infections, be it your rhinitis, be it your common colds, be it your tonsils, your adenoids, when they are infected, any of those, they interfere with the movement of the air between the throat and the middle ear. So unfortunately, organisms are able to go up into that air-filled space and create an infection. So as you can imagine, it's naturally air-filled. Once there's an infection, bacteria will produce pus, will produce fluid. Then the eardrum ultimately pops. Then we start seeing fluid coming out of that ear.
All right, let's take a quick call from Sam in Sandton. Good evening to you, Sam.
Hello, Aubrey. How are you?
I'm very well, thank you, Sam. What's the question for the doctor?
I am good. So I am good evening, doctor. So, my question is just around something that I often experience. I'm not sure if it's a skin condition or whatever the case is, but I often tend to get really dry, flaky, skin, particularly in my ears.
Yeah.
So not necessarily in the earlobe, but a little bit on the inside. And sometimes it tends to be a little bit scabby. I'm not sure if it's related to my psoriasis or if it's a form of dermatitis, and I'd just like to get a view of what it could potentially be.
Do you have psoriasis, Sam?
Yes, I do.
Okay. Doc?
Yeah, it's most likely, yes, related to the psoriasis. And once you start having flaky skin in the ear, possibilities are, yes, you could be having a fungal infection as well. Fungus have tendencies to create that itch. They have tendencies to also create the flakes. So I think getting a professional to look at it and confirm, because there are, for example, ear drops that contain chemicals that can help to soothe and comfort your skin if it's in case of a dermatitis, if it's in case of a fungal. We use antifungals. If it's in case of an infection as well, we do have those that have antibiotics in them.
Thanks very much. Yep. Go ahead, Sam.
Sorry, and if it is psoriasis related, is there anything that can be done?
Yeah, definitely. Okay. Yeah. Hence I say, it just needs to be confirmed. Once we confirm, yes, there's medicines we can prescribe. Unfortunately, it's a chronic challenge rather. So that means whatever treatment might be prescribed, you might have to be taking it possibly on a continuous basis or as and when you're having the symptoms.
Sam, good evening to you. Thanks very much.
Thank you very much.
Okay, Sam in Santon. Leslie is in Benoni. Hi, Leslie.
Hi, Aubrey, and hi, Doctor. I wonder if you can help me, please. I have a terrible buzzing in my ear. Any loud noise will make it will cause it, or a certain position. Is this tinnitus? And if it is, how do you cure it?
A certain buzzing in the ear, Doc?
Yeah. Yes, it's called tinnitus, and so that basically means a sound. Sound travels in waves, and those waves are supposed to move the eardrum. The eardrum is supposed to move the three little bones that you mentioned earlier on. So now, sometimes if there's anything that creates an interference in that flow, be it fluid in the middle ear, instead of the ossicles moving according to the sound waves, the fluid can interrupt that. Then they interpret that as a sound that your brain hears. Then you start picking up a sound that's not there. So it basically tells us there's an interference in the normal flow of the sound from the external into the ear canal through the eardrums. So there is some form of an interference there.
What can she do?
I would highly recommend she consult, get to see a professional who will look and possibly pick up whatever the challenge is, get it sorted, and the sound will disappear. A simple infection can also create a tinnitus because there's again accumulation of fluid and interference of those waves. Wax, if it dries up, forms a hard rock somewhere in the ear canal, that can also create a sound.
Leslie?
Thank you for that, because it's driving me crazy.
Sure. Please go and consult. Leslie in Benoni, thanks very much for your call. Allergies, Dr. Kganakga. Lately, I've been, every time there's a change in season, or maybe there's an overproduction of pollen where I stay, which I didn't have, but in the leafy suburbs, man, I never had that stuff, kokasi, but I think maybe the abundance of leaves and trees and pollen is contributing to that stuff now that I live here in Johannesburg. And then the ears will itch like you cannot believe. I mean, Nolene has just sent me a message now. Says, okay. Good evening, Bro Ops. I use earbuds regularly because the itch is excruciating. It feels like wax from my ears don't surface. The earbuds are always wet. I also experience a lot of dizzy spells, and I'm wondering if it has anything to do with my imbalance and dizziness, says Anonymous. What do you say to this person? But talk to me about allergies and how allergies can perhaps play a role in the excruciating itch that you get from ear infections, or from allergies of that nature.
Yeah. Ear forms part of a system that we call ENT, ear, nose, and throat. Those organs are interconnected. So yes, unfortunately, when you're exposed to pollen, you're exposed to industrialized areas where there's smoke, there's chemicals. The more we inhale, the more it depends if your nostrils are sensitive. Sometimes we do have referred symptoms. You might be inhaling but feeling the itchiness in the ear, because ears don't necessarily inhale any air or there's not much of air moving into the ears. Your sensitivity might be coming from what you inhaled, what you got exposed to through either your mouth or through your nose, and the symptoms are just now reflected in the ear. So having your allergies managed, there are anti-allergy medication that one can use that can control those allergies, and therefore they will minimize the symptoms in your ears.
And then, go ahead, Doc.
Okay. Oh, yeah. I wanted to say the question that the lady asked, that the earbud comes back wet. Again, I would say if you look on the package of that, what you call an earbud, it's written a cotton bud, because once we start calling it an earbud, people abuse it, and I believe it's designed for the ear and push it all the way and damage those 3 ossicles in your ear. So those are cotton buds. I often encourage even my patients, if you are to use for whatever reason, make sure your fingers are grabbing it at the most, the just at the edge of that cotton. Don't push it all the way into your ear, because you're asking for problems. We understand we don't want wax peeping through your ear canals, but at the same time, you don't have to interfere with that natural processes. If your cotton bud is wet all the time, that also is a problem. Your cotton bud coming back wet is telling us, yes, you've got moisture that's not supposed to be there. As I mentioned, wax, it's supposed to discourage accumulation of water. Once there's water accumulating, probabilities are you might be having, there's conditions like your swimmer's ear. If you swim, water stays there and accumulates for too long, that can create problems. Fungal infection can also create production of fluids. That also is a problem. And she mentioned issues about feeling dizzy or not having good balance. Again, an ear is not only about hearing. There's a part inside the inner ear called an organs of Corti. Those organs, they are sensitive. They pick up their proprioception. They pick up, if you close your eyes and tilt your head, those are the organs that are telling you whether your head is tilted to the left or to the right. So any interference in the ear can interfere with your balance.
Balance and the ear. Very interesting conversation. Urban Culture on X says, thank you for this conversation, Brobs. Kindly ask the doctor. On my part, I get an earache when I swallow or yawn. What could the cause of this be?
Okay. If you're in a plane and your ears get blocked, we often encourage yawn so that you can open the eustachian tube. When it opens, then that imbalance disappears and your hearing is suddenly back to normal. So the same mechanism that opens the eustachian tube, that basically suggests when he yawns or swallows, that tube moves something somewhere around that pathway. There is something that's not 100% right. Eustachian tube opens in the throat. Maybe the throat might be sensitive. Maybe, as we mentioned, allergies, if there's inflammation, if there's infections in that particular area, it's not normal to feel pain for swallowing or yawning. Once there's pain, we call that dysphagia. That suggests there's some form of pathology that might need some attention.
Talk to me about a little bit more about the relationship of the ear with our balance. What role does the ear play in that sense? When you're speaking, I got an image of a waterpas. What do they call that thing in English?
Yeah. In the spirit level.
Spirit level, yeah, right. As you were speaking, my mind just went to a spirit level. Is there some sort of relationship with the ear and balance and equilibrium? Talk to me about that, Doc.
Yeah, there is a jelly-like organ inside our ears, and that jelly-like, whenever you're standing in an erect position, it also stays in a position that tells your brain that we are standing upright. And the moment you lie, that gel swings to the side that you have either tilted your head towards, and then you can pick up. Hence, I say, when you close your eyes and tilt your head, how you know which side your head is tilted to, it's because of those organs. If you are in a vehicle and it moves and you close your ears, as it moves, you can pick up which side your head is moving into without you literally seeing that we are tilting to the left or to the right. So there are organs inside the ear that are responsible to give us a proprioception, to be able to see even without opening our eyes, and to be able to tell our position in space in relation to gravity. So if gravity is directly vertical to your body, those organs report to the brain. So once there's a malfunction, hence you'd have people that are suffering from illnesses like your vertigo. They are dizzy, but there isn't anything else anyway. Their hearts are fine, their blood pressures are okay, their sugars are normal. But unfortunately, those particular organs in the middle ear, in the inner ear, they are not representing or reporting the exact position in space of a person.
Let me speak to Cass in KwaZulu-Natal. Hi, Cass.
Hi, I'm well. I just want to find out from the doc. I am 64 years of age. I've been to an ENT.
Yeah.
And basically, when I told him about the ringing in my ears, which comes and goes, sometimes it's not there, sometimes it's there, he referred me to an audiologist. And basically, the audiologist is basically telling me that I must drown out the noise, to create another stimulus to things like that. So I want to know if there's a cure for that, for tinnitus or tinnitus. I don't know how you pronounce that.
Okay. Doc?
Yeah.
Lots of questions about tinnitus, by the way. Even on our other social media platforms, everybody asking about tinnitus, or how do I pronounce it?
Tinnitus.
Tinnitus. Okay, there you go.
Yeah.
Go ahead, Doc.
Yeah, unfortunately, sometimes at a young age, I often tell my son this, that he would put some AirPods in his ears. I could hear the music even though I'm a significant distance away from him. Unfortunately, the more loud sound you are exposed to, whether you're working in a factory, whether you are given earmuffs, you're not using them, whether you've got, I often get puzzled by the cars with so many subwoofers and the louder sound. Yeah, so unfortunately, the sound is beautiful. You probably are having a time of your life. But the unfortunate thing is, as you age, exposure to sound will start presenting itself, reminding you of your young years. Unfortunately, to some people, it's guns. If they are your occupation is a police, being exposed to those click sounds, they can damage your pathways of hearing the sound. Unfortunately, as we age, we tend to lose our hearing. We tend to be exposed to having tinnitus. So unfortunately, there isn't any. It's more like wear and tear. As you age, sadly, there isn't much of treatment. It's just more symptomatic treatment to soothe and make you comfortable.
It's just the management of that situation, I see, Doctor.
Correct.
Let's talk about that issue of sound. And, of course, ears are, the carrier of sound into our consciousness and so forth. When should we be worried about the various volumes of sound, either when it's either too low or too high? Is there something that can alert us to the malfunctioning of our ears as it pertains to sound specifically?
Yeah, the moment if you're a school child and your teacher has to call you once, twice, if you're a parent, you call your child more than you're supposed to. I think quite coincidentally today I saw one of the children that we picked up. He had wax. One of his ears was blocked. The teacher complained that they have to call him twice, thrice for him to hear. Coming in, we just found there was wax impaction. We simply irrigated the ear, removed the wax. He was very happy that he can now hear his mother and he should be able to hear the teacher tomorrow. So the moment people have to call you with a higher volume, the moment you want to listen to the news and your volume has to be louder, and everybody complains that your radio is too loud or your music is too loud, the moment you go through those are signs that are telling you that your hearing might have deteriorated. And yes, it's a good idea to either see an ENT audiologist so that, yes, that can be confirmed. There is a testing called an audiogram that is done that we can pick up which pitch of a sound have you lost. We can tell whether it's damage from the sound or if it's a medical hearing loss. Those tests can give us a guidance as to what is the trigger, what is the potential cause of your hearing loss.
Hey, my son, my brother, man, he loves to listen to my piano, man, a bit. And he makes sure that all of us can hear it. All of us, neighbors, everything. And he loves amapiano. We bought him these ear things. What again? These things we're wearing now. What are they? Earphones. And I worry about the fact that he also blasts those things when we can't hear him, and then he can't hear anybody. Should I be concerned about his hearing?
Yeah, the unfortunate thing is, yes, music is nice. It's nicer to enjoy it at a louder volume, and quite often with the headsets, people get lost in that music. It's very nice. But the unfortunate reality is the higher the heads in your ears. If you can imagine, as I was saying, sound travels in waves. Every time a wave hits the eardrum hits the ossicles move and create that sound into the brain. So you can imagine at a louder volume, instead of them moving gently, they are moving very much vigorously. So unfortunately, just like anything else, if you drive your car too hard on a gravel road, it tends to wreck, everything becomes loose. Equally so, our ossicles are at risk of sustaining a damage when we listen to music at a higher volume, or especially with the headsets. The danger of the headsets is they close even the air, so the sound does not even go anywhere else but towards your eardrum. At least with a speaker, I would say at least some of the sound waves, they go to neighbors, they go to people next to you. But with the headsets, I found them to be up significantly of a risk compared to your normal speakers.
I want to talk a little bit about when the sound is too much. In other words, if you're hearing sound and it's just too amplified without necessarily having loudspeakers or earphones that are too proximal to your ears, I wonder whether that actually happens. But let me take a call from Brian before we do that. Brian, good evening to you.
Good evening, Aubrey. Good evening, Doctor.
Yeah, go ahead.
Good evening.
Yes, I would like to find out if there could be, a correlation to my ears. What happened was that on the 14th, around the 14th or 13th of Feb, I started becoming drowsy, and it's been like that pretty much from then up until now. And recently, I was diagnosed with a middle ear infection on my left side, like my left ear. So could it be that this drowsiness is as a result of the ear infection, or could it be that other underlying issues, that have not yet been diagnosed?
Doctor?
Definitely. Infections would definitely interfere with the normal functioning of the ear. I would say it's possible, but we often are told, a patient is tip to toe. When you examine a patient holistically. I would suggest, yes, other things need to be ruled out. Your sugar levels, your blood pressure, your blood level, all of those things, they need to be confirmed. If all is in order, yes, then we can specifically say, most likely the infection. The good news with an infection, when it's treated, the infection should respond within about 72 to 48 hours. We expect the infection level to start declining. And then, of course, we encourage one to complete their course of antibiotics. If you complete your course, at the end of the course, I always encourage, the ear is not as perforated as most of the parts in the body. You might take your antibiotics, for argument's sake, your full 5 days. At the end of the 5 days, the infection might have not fully cleared. I often say, if after the 5 days your symptoms are not fully gone, don't hesitate. Come back for a review. If it means we extend the course of antibiotic, we might have to, because not too much blood goes into the ear, and therefore your antibiotics, they travel through your blood. If blood is not going there in numbers, therefore it means antibiotics are also not going there in numbers.
Thanks very much. Brian, Doc, I mean, we spoke about when somebody has to scream at the top of their lungs to get you to hear them. But is it possible that your ears can amplify sounds and make it louder than it actually is?
Yeah, it's possible. It's possible, but again, that's pathology. If when that happens, if people that are speaking softly and suddenly they sound loud, yes, definitely there might be pathology. There are people who are very sensitive to sound. For argument's sake, if you think of a child, an autistic child with autism are very sensitive. You play your music even with a gentle volume, that might just irritate them. They might just not be very comfortable, or even gentle talking to that child. So autistic children, they require special attention. So once the sound is magnified, the question is there pathology in the ear, or is it more of a mind issue? Like in case of an autistic child, that would be a mental thing, and therefore, they need to be treated with special care.
Is it fair to say that the older people become, the more sensitive they are to sound, such that some sounds become more amplified than they would be under normal circumstances?
Mm-hmm. Yep. Yeah, there's a condition, presbycusis. Those are, yes, again, wear and tear. As we age, yes, our levels, our thresholds, they change. You're no longer as comfortable as you were at a particular level that you were when you are younger. Hence, it's important to invest in your health. It's important to make sure that, most of the modern cell phones, even now, they do inform you. If you've been playing or you've connected your headsets on them, they tell you you've been playing higher volume for this much. We recommend you switch off or reduce the volume. So I think we need to learn to not see these warnings as just for fun, but as warnings that later in life will suffer the consequences of not listening or not adhering to those warnings.
Here's a message from Lila Williamson. Lila says, "Hi, doctor. I have just developed an uncomfortable feeling, my ear and my jawbone on the right side. What causes this? I don't have earache. It's on the outside," and that's from Lila.
Mm-hmm. Yeah, our bodies have got an immune system, and in immune system sometimes we pick up via your lymph nodes. Lymph nodes are part of your immune. Sometimes only your lymph nodes might just swell and become painful. So usually when there's a swollen lymph node in a particular area, we look and see which part of the body is that lymph node draining. If a lymph node is draining the ear, it can be either preauricular, which is before the ear, postauricular. So we look at the position of the lymph node and try to determine which part of the body is irritated or infected. Then look out and see what the cause is. Simple allergies can also trigger lymph nodes to swell. Infections are very common, are very notorious with that. Once we pick up that, then we know there is an infection somewhere. We look for it, we treat according to the nature of that infection. So moving your jaw probably moves the lymph node, and the movement of the lymph node creates that discomfort that you're having.
Final question from Bongi in Springs. She says, "Evening, Aubrey and your guest. My father is turning 100 years. Wow, congratulations. In May. The last ENT specialist removed compacted waste from his ears and the hearing improved. Now it has deteriorated again. Is he a candidate for the hearing aids? On a phone call, he hears better." And that's from Bongi in Springs.
Mm-hmm. Okay. Yeah, there's different types of hearing losses. There's something that we call a bone conduction. Behind your ear, if you touch yourself, you'll feel there's a prominent bone there. That bone can also hear. There are times where when a patient has lost hearing through the normal canal, that they can hear through the bone conduction. Such patients would tell you that, yes, because a cell phone, you naturally put it on the ear. It might be that the sound goes through the bone and it transmits the sound. It might be the reason why he hears better on the cell phone. So meaning the natural way of picking up the sound might be dysfunctional, and therefore he's picking up through that bone conduction.
Dr. Matome Kganakga, thank you so much for joining us, sir. And let us know what is your contact details if anybody wants to get in touch with you, maybe consult, talk to you about these issues. What is your contact number?
Based in Sunnyside, Pretoria. The office number is 012-341-9340.
Dr. Matome Kganakga, thank you so much for joining us.